Good afternoon, everyone. It's Mark Poloncarz coming from my office here at the Rath Building in downtown Buffalo. Got a little Beatles White Album on in the background to answer some of your questions and give you information on the COVID-19 outbreak in the world, as well as what's going on in Erie County. We are live on Facebook Live. You can ask your questions in the comments. However, I'm not going to, of course, be able to get to every single one of them due to the fact that after the last time we did this, we had hundreds of questions come in. And I'm going to try to check and see, make sure that my system is up here. My laptop has actually got the Facebook Live. It does. I've got it right there, no volume, but hopefully it'll start having some questions come in and I'll refresh that. First off, I want to give you some information. We will be updating the number of cases in Erie County through our new interactive dashboard map that you can find at www.erie.gov/COVID map. So that's www.erie.gov/COVID map. We just updated that recently to identify that there are now 50 confirmed cases in Erie County, and the three new cases, from those that we had identified through yesterday. Two of them are in Buffalo and one of them is in Clarence. So right now there are 16 confirmed cases in Buffalo, 13 in Amherst/Williamsville, and then the next largest community would be 4 in Clarence and 4 in Hamburg/Blaisdell. If you go to the interactive map, it's taking a lot of hits. We've had almost 100,000 hits on it since we released it last night. It works best if you are at a laptop or a desktop. It does work on a mobile device, but it takes a little longer to load. We're looking at trying to create a mobile application that will be faster. For now, we just ask for everyone's patience. It takes a little bit of time. Sometimes you got to refresh it, but if you're on a mobile device, it works very well on a laptop or a desktop. And we're also going to be updating that with information regarding individuals who've recovered from COVID-19 in our county, as well as hopefully we never have to identify it, but if we do, the deaths and where those individuals reside. We hope we actually might have some recovered by the end of today. Our epidemiologists from the Erie County Department of Health are in contact with individuals who have had COVID-19 to determine if they actually have gotten through COVID-19. So I want people to understand there are going to be recovered and we'll identify those. Now, remember, just because your community might not be on the map doesn't mean that COVID-19 isn't in your community. We're going under the assumption it's everywhere. We have a limited number of tests that we can perform, and so when we get a positive result from those tests, we identify it in our COVID-19 map, but I'm not going to be able to tell you exactly how many people are in Erie County have COVID-19 because we're not testing every single individual. We don't have the capability of doing that. We have currently about 300 outstanding tests that need to be completed through our lab. It's still going to take us a few days. Right now, they're processing tests that occurred, or swabs that were taken on Tuesday, March 17th. They're hoping to get through all of Tuesday, March 17th, and at least a part of Wednesday, March 18th swabs today. We're running on a 3 to 4 day lag because they only can do so many tests per day. We know that Quest is doing tests for our community. They have tested a number of individuals in our community already, and we are getting the response from Quest with regards to those that actually have tested positive. We don't know who tested negative. We only know from Quest who tested positive. So that's some information that we have. We'll take a couple questions and then I'll go back with some other information. We have a question from Katie Lynn. What about masks for nursing home workers? We almost have none left at work in OP, which I assume is Orchard Park. We are being told to reuse our masks. We understand that is a legitimate issue. We are working with the governor's office to obtain more N95 masks and other masks for people in our community that are healthcare workers. The call has gone out. If you have masks and you don't need them, to please contact New York State Department of Health so that they can use the masks for healthcare workers. Erie County has a limited amount of masks that we keep for our staff. We are working with others to acquire masks for healthcare workers in our community. We know it's a legitimate concern, and I just want to let you know it is something that we are working on, and I will continue to work on, including having been on a conference call with members of the governor's staff earlier today about how soon they can get the masks that are being delivered to New York from the federal government. Speaking of New York, the New York COVID-19 hotline is an important number you can call if you have questions anywhere in New York State. That number is 1-888-364-3065. So if you have questions, you can call the New York COVID-19 hotline. You can also call, if you live in Erie County, the Erie County hotline at area code 716-858-2929. That is open from 8 a.m. to 8 p.m. every day of the week. We changed the hours from 9 to 9 just because it made more sense. There were more people calling in the morning and less people in the evening, so we're going from 8 a.m. to 8 p.m. And also, there's a lot of questions with regards to employers and who's essential and who's not. As it was directed by New York State Governor Andrew Cuomo, as of Sunday, tomorrow at 8 p.m., all non-essential businesses must close from their locations. People can work from home, but they cannot work in their offices. A lot of questions as to what's essential or not. Empire State Development Corporation, the arm of the governor's office, has a great website. You go to esd.ny.gov and you'll find the list of who's essential. If you're not on that list, you're not essential and you have to close. You can seek an exemption from New York State. That exemption is available through Empire State Development at that website, esd.ny.gov. And if you have a violation of a company that is forcing people to go to work that is not essential, we have a new number from the New York State Attorney General's office to offer. And I want to thank Attorney General Letitia James, who I was in contact with 2 days ago. I called her to say we need help from the Attorney General's office to enforce the law. So the new number from the Attorney General's office is 212-416-8700. Once again, that's 212-416-8700. Or you can email a report to labor.bureau@ag.ny.gov. Once again, if you have a report of a violation, please don't call our COVID-19 hotline. That's for health issues. It should go to the New York State Attorney General's office at 212-416-8700, as well as you can send an email to labor.bureau@ag.ny.gov. Now let's see what I can pull up. There's a lot of questions that are coming in, and I know I'm not going to be able to get to every single comment, but let's see what we have here. They're coming in fast and furious. We got a lot of questions with regards to the hotline and for the AG's office. Once again, that's 212-416-8700, and people saying what's essential and what's not. Yes, we know that there's a lot of things that think they're essential. As the sign on my Chief of Staff's desk says, you're not special just because you think you're special. It's very important that people understand that. We actually appear to have a question from my brother, which was regarding Erie County's health lab tests, which, because we're getting so many questions in, they're moving very quickly. It was, when can we expect more tests? There are 300 outstanding tests right now sitting at the lab. They hope to get through the Tuesday ones today and part of Wednesdays. We are hopeful that we are going to get new supplies of reagents and testing swab kits on Tuesday. We've been told to expect on Tuesday new test kits as well as the reagents necessary to perform these tests by Erie County Public Health Lab. I unfortunately do not have the ability to change that. We're trying to get them from every source we possibly can, and unfortunately they're very limited on what we can get. So what I'm just asking is that individuals understand that we are doing the best that we can in a very difficult situation. I know of many other public health labs across the country that are having difficulty getting test kits and reagents. We don't have those normally. 6 months ago, if you had told me about COVID-19 or coronavirus, I wouldn't have understood what you were talking about. And we are doing our best to get the information that we possibly can. A lot of questions about businesses, and we just want people to understand we're doing the best that we can with regards to getting information out. That's why I want you to call the AG's hotline at area code 212-416-8700 to get the information. We have a question from Ray Budd about a driving ban. Will there be any sorts of driving bans in the future? There are no driving bans. While we have a state of emergency, there are no driving bans. We understand that people are scared. You can get out of your house, though we want you to do it smartly through social distancing. You can go to the park, but you should not be in groups of individuals. Our parks are a great place to go with your family. Somebody asked a question earlier, can we go out and ride our bikes with our kids? The answer is yes, but you should not go in groups of individuals that you have not been in contact with, because that's how the disease is spread. It's a virus, and it can be spread from person to person. If you're with the people that you live with, you're constant contact, of course that makes sense to go out together. If you're a little warmer out, you want to throw the football with your kid, throw the football with your kid. But don't bring the kids together from the whole neighborhood to have a football game or a baseball game. It's just a little too dangerous when we're talking about social distancing, keeping people apart. So it's okay to get out there. If you got to go for a drive to go to work to pick up something because your work is considered non-essential to do work at home, you can do that. But we want people to understand that we need you to follow the rules. It's very important that we follow the rules. We're going to try to test as many people as we can, but I want everyone to remember, COVID-19 is here as an illness. The coronavirus is here as a virus. You can't hide from it. Even though we might not have results from every community showing that there's a positive case in every community, and there's some that have not, we believe it's in every community. And the best way to protect yourself is to social distance from those that you're not in direct contact with. We have a question from Joe Loveland. Can an individual get unemployment if they can't work to care for their children? Yes, you can apply through the New York State Department of Labor for unemployment. I'm going to pull that right up now, New York State Labor, and you can apply online for unemployment. You can also apply for health care and in what would be considered Supplemental Nutrition Assistance Program. That's the old food stamps program through the Erie County Department of Social Services. I went right to it's labor.ny.gov/home for the Labor Department, and it's got a big thing right there, important information for unemployment insurance claimants. It tells you how to apply for unemployment insurance, unemployment assistance. You can get that right through New York State. If you're seeking assistance for health care through Medicaid, if you're unemployed, or you're seeking assistance through our food stamp program, our temporary assistance for needy families program called TANF, I think it's important that you know that you get that through the Erie County Department of Social Services. You can go to erie.gov, click on our Social Services Department for more information. Applications can be done online, and we're asking everyone to do them online. We think it's important rather than have people come into our office in downtown Buffalo. The office in the Rath Building to apply for public assistance is open. Well, it's not open today because it's not open on Saturday and Sundays, but it is open Monday through Friday. So you can apply in person, but you don't need to. You can apply online, go to erie.gov through our Department of Social Services, and you will be able to find everything you need to actually apply for assistance. So if you need unemployment assistance, you apply through the New York State Department of Labor. If you need assistance for public assistance, temporary assistance for needy families, that's like additional aid to help you get through this short-term period, as well as health care, you go do that through the Erie County Department of Social Services. I have a question with regards to the parks. Are the parks open? Yes, the parks are open. The parks are available for your usage. The bathroom facilities and casinos will be open. We actually got more portalets. However, you should be under the assumption that those are only cleaned once a day. And the bathrooms are cleaned either at the end of the day or the start of the next day. If you're going to go, you should probably bring your sanitizer, some wipes to wipe down the toilet facilities if you need to use them. You can go to the parks. The playgrounds are now closed. The swings will be taken off the swing sets. They started that process yesterday. There's a lot of swings to get to, and so the Parks Department's actually working with the Department of Public Works to do that. So we'll be doing that in the parks, but the parks are open and you can utilize them. But please use extreme care. The tennis courts, the tennis nets are being put out, but the tennis ball, you could grab that and get the virus off it. So only play tennis with those you've directly been in contact with, but you may have gotten the virus from otherwise. We also have a question, what's with the sign on my door? I am a man. The I am a man sign, and that's from, I just lost his name there, but the I am a man sign is in regards to the sanitation strike in Montgomery, Alabama that Martin Luther King led many, many decades ago. And when we were redoing it as an honor to MLK last year, they gave us the sign. So that's what the I am a man sign is for. There was a question regarding drive-up testing clinics. We're not doing testing at this time until we get more testing swab kits and reagents. We did have a drive-up clinic, but those individuals had to be previously approved by their doctor in the Erie County Department of Health. You couldn't just show up to the clinic and or to the drive-up clinic and get a test done unless you had prior approval from the Erie County Department of Health, as well as the your doctor. So what we're talking at this point is that we would hope to have more clinics in the future, drive-up clinics, but we will not do those until we have the test kits and reagents to actually do the tests. There's no sense in having a clinic if you can't take the samples. There was a question from Ashley Franz, anything about limiting certain purchases in stores, can't find disinfectants anywhere. We have been in touch with Wegmans, Tops, and all the major retailers, emergency managers. I don't know if you realize it, but they do have emergency managers, and our Department of Homeland Security and Emergency Services has been in touch with them with regards to restocking their supplies. We have made recommendations to them on usage and on limitations. As I think most know, they're limiting the amount of toilet paper you can buy. We hope they will limit also the types of disinfectants that you could buy so people aren't hoarding them. It doesn't make sense to hoard. It really makes no sense. We want people to understand that. The supply chains are there, the goods are coming in. Please don't buy everything. We're asking retailers to not sell everything into one or two people so that other people can buy it. We've had questions regarding daycare. Why is daycare open? Well, daycare is an essential service. We need to provide childcare to the individuals in our community who are responding to this crisis. Whether it's the individuals in the public health lab or the public health department from Erie County, our emergency services department, of course the people that are working in the hospitals, as well as urgent cares and doctors' offices, they need child care, otherwise they cannot go to work. My understanding is on the first day of schools being closed, over 800 workers at various hospitals called off. And that's kind of a scary thought because we need those workers in the hospitals. They were calling off primarily because they had to take care of their children. So childcare is available. It is considered an essential service, but if you're at home, we ask you to not send your children to childcare so we can open up those spots for workers who have to be out providing a service for the community, whether it's an Erie County employee or someone who works at a grocery store and needs to go to work so that you can buy the supplies that you need. So that is why it's very important that we keep daycare available. I know there's been a lot of people wondering why. It's not the same as schools. It is essential to have it available. And I want to remind everybody who are saying that, well, I can hide from this. You cannot hide from a virus. You might be able to get away with it for a few weeks, but it's around. It's going to be around for months. We are doing our best to protect individuals at this point through social distancing, but you cannot hide from it permanently. We're going under the assumption it's out in every community. We're all going to be contracted with it one way or another. There are individuals who are ill in hospital right now. There are others who are recovering nicely at home and may not even have a symptom or two. It really just depends on how the virus impacts your immune system. We want to keep social distancing in place to protect other people. Maybe the virus won't have a tremendous impact on you, but it could have a big impact on your parent. So we're trying to protect people in the greater community and do it in such a way that we are not overloading our healthcare system with new patients coming in. We had a question regarding locations of individuals where a virus has been detected. Have we been able to get out every location? And the answer is no. We have not been able to get out every location. As was reported in local media, There was a case where a sheriff's deputy who was reporting to the Alden jail came in sick. He left halfway through the day and went to an urgent care, was tested. We got the result. It was positive. The individuals in the jail that he became in contact with are in quarantine. The sheriff's deputy is in isolation right now. We are not going to be able to report on every location that every individual went to because, truthfully, we don't know every individual who has it in our community. What we're trying to do is get as much accurate information out to protect the public, but we want people to understand that it is out there. And just because it may not be in the town of Boston or my hometown, the city of Lackawanna, on our COVID map, doesn't mean there's somebody in those communities who has it or doesn't have it. It's there. We will update the COVID map with confirmed cases. Once again, that map can be found at www.erie.gov/COVID-MAP, COVID map. And it is best viewed on a desktop platform. You can view it on a mobile platform. It just takes a lot longer to load up due to the many, many layers that exist. Let's see. I have a question or more a statement. You need to protect the medical staff. They need COVID-19 testing and necessary protective supplies. Without them, we are all at risk. We are trying to get the COVID, first off, we are testing as quickly as we can medical staff who appear to have been in contact or may have the symptoms. As was reported yesterday, ECMC reported that a staff member has contracted COVID-19, and that staff member is currently a patient at ECMC and is recovering. We do know that it's out there, and medical professionals are going to come in contact with it. That is why we are working very hard to get the PPEs, the personal protective equipment for individuals in healthcare, as well as our public health lab and other places. I truly understand the public's concern as well as the concern of healthcare professionals. We are in uncharted waters. This is not something we would have expected 6 months ago. We can talk about what happened in the past and how we got to this point, but what we really need to do is focus on the future and what we can do as a community, as a state, as a country, as a world, to try to limit the losses that will result from the COVID-19 illness. We're doing the best we can. I'm trying to do as best as we can in very, very difficult situations. And we're going to continue to get accurate information out to the public as well. I want to thank the members of the Erie County Department of Health, the Homeland Security, and all of our staff. We have people from all over working in new jobs, new roles to help people while there's others that are at home. I want to thank all the governmental workers elsewhere, from the sanitation workers who are picking up garbage to those who are helping to address this issue, as well as the healthcare workers. We know it's going to be a difficult time. A lot of people are stuck at home wanting to get out. You can get out and do it safely among your family members, but we don't ask you to get in contact with other people you haven't been in contact with. And just understand that we are all in this together, folks. The best way to protect ourselves and to protect our family members and neighbors is to avoid that close contact that could spread the illness. We know the illness is out there. Other people are going to get in contact and have it, but we're trying to reduce the impact and the greater impact in the long run in the community. I've got time for a few more questions. Unfortunately, I'm going to have to get on a conference call very soon, and we're just advised that the president is also on. But I want everyone to understand that it is going to take some time to get through this. We are not going to be able to get through this in another few days or a week or two. This may go on for weeks. And the latest report is the second quarter, which we're in right now, or actually we're not. The second quarter starts in April. We'll be out there for a while, and we know it's going to have a negative impact on the economy. We're hoping that we can get through this by the end of the second quarter and then get back to normalcy with people going back to work, production back up at manufacturing plants. It's just a very difficult time right now. It's serious. I know a lot of people are scared out there, and I just want you to know that we got a lot of great people that are working very hard every day to get you information so that you know it's the most accurate information going on, from our healthcare professionals to My staff member, Derek Smith, who's manning the camera today. Derek's been here every day. He's been working downstairs in our Erie County Department of Health, helping with social media. And we want everyone to know there's a lot of folks that are working very, very hard, putting in 12 to 16-hour days, and we'll continue to do that as much as we can. I'm actually sending people home so that they're not here and not burning out. But we're going to be able to send people, make sure they don't burn out, because we could be here for quite some time. And I want people to understand that it's going to be a while before we get through this, but we're going to be here for you through the duration of it. And hopefully we will all be a stronger community for it. One more question. I work in an essential job and have an elderly mother at home. I am on FMLA. Do I have to work and risk my parent getting sick? That's from Nathan Sean. Nathan, you can make that decision on your own. If you're an essential worker, you have the ability to get out there and work, but I also understand your concern about potentially going out and then putting your mother at risk, and that's a serious concern. I'm not saying you have to work. That's your decision to make. I actually visited my parents for the first time since they came back from Florida yesterday, and I stood outside on their back patio because I didn't want to go inside their house because I've been around too many people. I have no reason to believe I have the coronavirus and COVID-19. I'm not showing any symptoms, anything like that. But I didn't want to go into my house and see my parents who just came back from Florida. So while I was standing on their back patio, I was talking to them through their patio door. And I just said, be good, Mom and Dad. I said, don't go out. Myself, my brother will drop off food and supplies for them. They're in their 70s, and I'm worried about them, just as I know Nathan's worried about his mother. I can't tell you what to do. I can just say, do what you think is most appropriate for you and your family. We need essential workers to go to work, but we also understand there are people who might not be able to do it because of issues associated with childcare, or for this example, taking care of an older parent. This is going to be very, very different times than we're used to, and I just need everyone to stick together so that we can address this in the long run. Final question before we go. Someone said, sounds like he's either listening to Bob Dylan or Grateful Dead, maybe Neil Young. Actually, we have the Beatles' White Album on in the background. So we got a number of different songs going on. It's pretty low, so it didn't interfere, but I've been listening to music all day, all kinds of different music. I've been doing the song of the day based on what I see, and earlier today, the song of the day was Sounds of Silence by, oh my God, I'm losing my mind. Simon and Garfunkel. Because a couple days ago I was driving home and I saw a neon sign lit in an empty restaurant and no one on the streets. Just know, folks, that we're going to try to get through this with as normal as possible, with music in the background, thinking about the good things that we care about. And I want you to understand we're going to be here for you during that time period. So thank you. Thank you for all that you're doing. Working together as a community, we will get through this. We will weather the storm. It won't be easy, but I know we'll be a stronger community for that. With that, I'm going to say goodbye. I have to get on a conference call with the governor's office with regards to supplies that we are requesting from them. We're all in touch as we move forward, and hopefully we'll get those supplies, those PPEs, and the additional testing kits so we can do additional tests. But from Erie County, if you want to get the latest information, go to our COVID map, www.erie.gov/COVID-MAP. You can get the latest. There are 50 confirmed fit cases right now in Erie County. We will also update that with the individuals who've recovered, as well as deaths upon information and receiving that. Hopefully we'll never have to add a death. And for all, always make certain if you need information and you've got questions on the illness and health issues, you can call our hotline at 858-2929. 858-2929 to report a violation of the governor's orders regarding essential business and non-essential business. Once again, call the Attorney General's hotline at 212-416-8700. Once again, that's 212-416-8700. With that, I'm going to say goodbye from my office. Thanks, Derek, for the work that you're doing and on social media and helping to run this. And thank you to each and every one of you out there for the work that you're doing to create a better community during very difficult times. Working together, I know we'll be a stronger community as a result of this, and we'll be here for you in the future. Thanks, everyone. Goodbye.